This is an update. It's Monday, 24th of September, 2024. Yeah, things are not going well at all. So a couple of months ago, I started a different chemotherapy. The previous one had stopped working. This one is called Lonsurf, and I have it with a drug called Avastin, also called bevacizumab. And Lonsurf is I think it's a third-line chemotherapy, although technically I'm on about my fourth or fifth chemotherapy because I've kind of changed protocols several times. So Lonsurf is not very effective, and the side effects are very tough, as I'm finding out. There are some side effects that like impact your quality of life, and there are others that you're not aware of, but it's sort of damage being done to your organs or that kind of thing. The big side effects I'm having are extreme fatigue. The chemotherapy it's not a drip, it's like tablets you take, so a couple of tablets in the three tablets in the morning, 3 tablets in the evening, and the tablets change, or the drugs inside are prodrugs, so they change into chemotherapy agents in your liver. And then I'm finding kind of a few hours after that, I suddenly get a wave of fatigue, and it lasts many hours. So yeah, today, for example, which is day 4 of a 5-day cycle. Yeah, I've just been completely exhausted all day. And the other big side effect for me is loss of appetite. So the chemotherapy sort of changes how food tastes in your mouth, and it has appetite suppressing properties as well, so you just don't feel hungry. And then there are the other side effects that are kind of internal, I guess. It's not really the right word, but I mean things that I don't perceive but that are happening. So last 3 weeks ago, I was due to start the second cycle of this chemotherapy, but the blood test showed my white blood cell count was too low. So the Lonsurf had been causing neutropenia, where you don't have enough white blood cells. So I couldn't have it. And then last week, starting this cycle, I was meant to take the other drug first, Avastin, which is a drip you take at hospital. So the protocol is you have a drip at hospital, and then 5 days of tablets, 2 days break, 5 days of tablets, 2 days break, another drip at the hospital of Avastin, and then 2 weeks break. So it's a 4-week cycle. But when I went last week, one of the tests showed my kidneys are damaged, or in the process of being damaged, which meant that it wasn't safe to have Avastin. And unfortunately, Lonsurf is not an effective chemotherapy, and without Avastin it's particularly ineffective. So potentially I'm getting the damage but no benefit. But I don't have any choice at the moment. It's just it's the only thing that is really available without sort of more funds for immunotherapy. Although thanks to your donations, I do actually, I've been able to pay for the next round of immunotherapy, which is going to be in a couple of weeks' time. So yeah, that's my current situation really. I'm trying really hard to eat and keep my weight up. Last time I did lawn surf, I was losing over a kilogram a week. And yeah, I've just started this cycle. The effects of lawn surf, the negative effects of lawn surf last a long time, potentially months and months. But at the very least, the 2 week rest period is when you have the most severe side effects. So that's when you have the most bone marrow suppression, for example. Yeah, so I'll try and keep making these videos. The main thing I have to do now is really get into a clinical trial. So I've been working on that. Had meetings with the various doctors, and last week I met the head of a cancer hospital, who is going to try and get me in a trial. Although it seems one issue is that some Japanese drug companies don't want international patients to join trials in Japan because they say the documentation is all in very technical Japanese. I'm hoping that won't turn out to be an issue because I can have a Japanese friend with me anyway, to explain all the intricacies. And the issue of informed consent is, I know it's a big deal in medicine, but I mean, there'd be no way that I wouldn't sign the document. If I'm offered a clinical trial, I have to take it, because this, the chemo is not going to end well for me. So that's it really. So other than struggling with the side effects, I've just been existing from day to day, really. Trying to get some exercise, but that's been very hard due to the fatigue and the appetite suppression. But that's something I really have to work on, is eat more so I can get my weight up a bit, and then, or at least keep my weight as it is, and then just do whatever exercise I can manage, so that I don't lose a lot of muscle. Another side effect lawn surf has is kind of chest pains, and that's a little bit scary. So I think that the chest pain is kind of exaggerated because of being so fatigued. I'm often just kind of slumped in a chair or lying in bed. So if I can get out and walk a bit, or maybe go for jogging, to loosen up my body a bit, and I think at least some of the kind of pain is caused by that. And the other big thing is, for the first time in 8 years since having terminal cancer, I'm actually getting pain from the cancer. So I've got sort of persistent abdominal pain in my lower abdomen. It's not bad pain at all. It's, the nurses always do the questionnaire with you at the hospital before chemo, and my pain, I say it's like, on a scale of 1 to 10, it's like 1 or 2, but it is persistent 24 hours a day. And the only thing that really takes the edge off is taking opioids. I've been prescribed OxyContin and Oxynorm. OxyContin is a slow-acting opioid. Oxynorm is the same thing, but as a quick-acting one. But I'm really trying to take neither of them because the side effects are nasty. Appetite suppression being a big one. It causes issues with sleep, and also they cause like gastrointestinal issues, like stomach issues. And I found if I take OxyContin just once, then I've got kind of gastrointestinal issues for like 3 days. So yeah, I'm trying to avoid the opioids. So yeah, at the moment the priorities are keep eating and keep fighting to get into a trial, and that basically involves trying to meet more doctors, go to more hospitals, especially more hospitals that specialize in trials. It's actually quite a manual and ridiculous process getting into a trial in Japan. But from what I've heard of other patients in other countries, it's kind of similar. We're given this impression that you can find a suitable trial and get in, and it's very straightforward. But the reality is that oncologists don't really know about trials unless they happen to have some personal connection to someone or an institute doing a trial. There are trial databases, but the information is always out of date, and it's never enough information to know if the trial's applicable for you or not. So you have to basically do this stuff manually and go and make appointments at hospitals and talk to doctors about what they have available. And yeah, it's a difficult process when you're really sick. So, yeah, I'm finding it very hard. Yeah, I'll do another video soonish about the NPO stuff, because yeah, there's lots of good stuff to report about that. But in the meantime, yeah, if you can share this video, share the donation link, hit subscribe, hit like, or whatever, that all makes a massive difference. And yeah, thank you for your interest and support. Thanks a lot.